everyone, and welcome to another episode of Raw with Rasha. I'm excited to have all of you guys here. Today's topic is one that requires a conversation and is sometimes overlooked: postpartum depression. I especially want to dedicate this episode to Nima Bhakta, who we unfortunately lost to postpartum depression earlier this month. My condolences and prayers are with her family, but she definitely helped ignite a conversation around this topic that really needs to be had, not only here on my platform, but amongst other women, and especially with medical physicians and their patients. I'm excited today to be talking to Dr. Anandhi Narasimhan, who is a child and adult psychiatrist here in Los Angeles. She's been featured on CNN, CNN International, USA Today, Vice, and many other media platforms. And I'm really looking forward to some of her input and advice she has on postpartum depression. Dr. Anandhi Narasimhan, thank you so much for joining me to talk about this very important topic, postpartum depression. You have worked with patients too that have gone through this, so I'm going to dive right into it and just ask you, could you tell us about 2 to 3 symptoms that, women are often told, oh, well, this might be normal during pregnancy or after delivery, but really are symptoms that they should be looking out for?
Yeah, so actually one of the things that we need to watch for is depressive symptoms that occur in what we call the peripartum period. You can actually start experiencing depressive symptoms before giving birth. So there's been a shift in the way we look at postpartum depression. And then women are also risk after birth. And some of the things that they can feel are just depressed or an irritable mood, a lack of motivation, feeling guilty, thinking that they're not able to care for their newborn baby, having trouble concentrating. Those are a few things that you can see in postpartum depression.
And how should people go about treating these? They might not even realize they have them. So once they recognize it, how do they go about getting treatment or addressing it?
Yeah. So, one of the things we consider is a person, particularly anyone, can be at risk. Majority of women, when they give birth, about 60 to 70% of them do experience some depressive symptoms. There's a term called postpartum blues, which is actually normal after giving birth. You see, when you give birth, there's a huge fluctuation in hormones, and that can cause mental health symptoms just based on that. Plus, there are other factors as well. So one of the things is there has to be attention to providing the new mom with enough social support so that she doesn't feel more isolated. There should be access to mental health care. So, OBGYNs need to be vigilant. And we also need to have some preventive measures in place. There's already like a therapist that you can talk to after you give birth. There's some resources that the new mom knows about that she can immediately get help after delivering if she's experiencing some of these symptoms that are just overwhelming. The other thing is sleep deprivation. I think there's a kind of the sleep deprivation after a woman gives birth is kind of culturally sanctioned as part of the normal experience, but it actually can contribute to worsening of mental health symptoms. So that is something to acknowledge and monitor and address.
From hearing you say this, I almost feel like, would it even be encouraged then for every woman who is giving birth to a baby to maybe consider having a therapist along the way?
Right. It's not a bad idea. It is not a bad idea to have someone to talk to, someone that can help you build your resilience and your coping skills, so that when you are experiencing certain symptoms, you know how to manage them, whether it's with certain therapeutic techniques. And also, it helps you know what to look for. When you have another person monitoring your symptoms as well, like, hey, do you feel this way? Do you feel that that way, or they give you like a checklist of symptoms that you fill out. That's another person that can help guide treatment and help guide where things go.
What can partners, friends, or family members do then to help out?
I'm glad you asked that, because interestingly, men are also at risk from experiencing postpartum depression. It's not as common as it is in women, but if their partner has the symptoms, they're more likely to also experience some of the symptoms as well. So it can be actually a unit, a family that experiences. There's also been some research on homosexual couples that they also can experience, their partners can experience depressive symptoms. And sometimes they experience symptoms more because they don't have the social support, whether it's tension between other family members, or the discrimination, the homophobic discrimination that they experience. This is a time where women do need support. I think it's also complicated. I've met new moms who are delivering during this pandemic, and they feel incredibly isolated because they can't even have their mother or their in-laws come over because they're socially distancing. So that's very challenging. So finding ways of increasing that social connection can be quite helpful.
One of the things, of course, as you know, that inspired me to have this discussion was Nima Bhakta, and something she left behind saying was, it was something you guys wouldn't understand because the Indian society does not fully understand postpartum depression. That statement really hit me. And I know it's not something that's often talked about, but I'd love for you to maybe tap into the cultural dynamics that we have, including the partner, but even the mothers and mother-in-laws, because I really think we could get some good advice here on how to navigate that and really allow for the woman to feel in her space and work through this without pressures.
Right. You know, the story of Nima is so tragic, and my heart does go out to her family members because that shouldn't happen. No woman should feel that amount of despair that suicide is a way out. So it's very unfortunate, you know, that somebody gets in that extent of pain. What she did leave us with is something that is very accurate. There has been enormous stigma in the South Asian community around mental health. In our community, we need to unveil the secrecy. Um, I think also a lot of South Asian women feel a lot of social pressures and social expectations from families that they're part of, or families that they marry into. And some of that's culturally sanctioned. You know, a woman might be expected to go to work, you know, take care of a new baby and clean the house and cook and do all of these things. If she's a working mom, the research actually shows she doesn't have a reduction in her domestic duties. If she works, she just has longer days. The other thing I want to highlight is that pregnancy and the postpartum period also leave a woman very vulnerable to abuse. There's a lot of abuse that happens during pregnancy and after childbirth. It's not spoken about. You know, women feel a sense of shame, of failure, you know, to say that this is happening, but that also adds stress, and it can cause a worsening of mental health symptoms.
There's a lot of judgment, right? There's that role to be superwoman, or what society's going to think or families are going to think. And how can we push forward? How do we move past that? Do you just own your power? Because, you know, this is really heartbreaking to me, for you to have a child and then to deal with all this on top of it, and then to feel isolated and alone. I mean, I don't know. It's heartbreaking for me, and it frustrates me to hear that go through.
Yeah. It's very complicated, and it takes a lot of personal empowerment to not listen to that judgment and to think, I'm going to do this for myself. I need help. I'm going to talk to someone about it. I'm going to stand up for myself. And because I'm worth it, I'm worth, I want to feel good about myself. I want to feel good about being a mother. I also think the dialogue to raise awareness, like you're doing now, you're putting this out on a platform so that our community talks about it. In India, the climate is also changing there for how women are. And I think it's a good thing. I think that is a really good thing, because I think as South Asian women, we're often conditioned to believe in sacrifice and martyrdom, so to speak. But that's not always protective for us, as individuals, as people. But we're conditioned to think that way. So sometimes we put other people's needs over our own. But I think reclaiming the fact that you deserve to feel good, you deserve to have happiness, you deserve to enjoy these special moments of bringing a child into this world.
What advice would you have for South Asian people, like members of the family, mothers, mother-in-law, other family members, especially when it comes to dealing with postpartum? What can they do to help someone who is expecting or has delivered a baby in the family?
Yeah, I think that other women and everybody in the family um, can work on building their own empathy for what the new mom is going through. Maybe that's not the time to throw more expectations or criticisms at her, which shouldn't be an ongoing norm anyway. But really developing some empathy for the person going through this experience. And offering support when you can. Some new moms, they don't want a lot of people involved, especially now, but like some, they don't. They'd rather have the privacy of the experience themselves. But just having an understanding that it's a different experience for everybody and it's their own personal journey, and just having some empathy around that. And if they are irritable at times because they haven't slept a lot or whatever, just like kind of just rolling with the punches a little bit sometimes, because it may not be entirely in their control what is happening to their mood.
Dr. Anandhi Narasimhan, it's been such a pleasure talking to you about this very important topic, postpartum depression. And thank you for giving us your advice and information. And I hope that this discussion will help those that are watching out there, and that you will share this discussion with someone that you know.
And thank you, Rasha, for giving attention to this very important topic. I really appreciate it.
Oh, it's been my pleasure. And thanks to all of you guys for joining us on another episode of Raw with Rasha.